Want the weather? Check our website at WRCR.com.
And the current temperature is 74.
Radio Unscripted, AM 1700 WRCR and WRCR.com.
The following is just audio, is right? Paid for and furnished by its producers, hosts, and sponsors. I don't understand. If it's a radio show, how is it video? Within do not reflect the opinions of WRCR video. Radio or Alexander Broadcasting.
As well.
We're very talk radio popular. With video?
Look very handsome.
It's Monday time for the Live at 5 drive. Tune in and turn on to the Good Health Lawyer Radio Hour. I'm your host, Patty Finn. The call-in number is 845-429-1700. Join me here live every Monday, WRCR Radio, 1700 AM. Rocking your health and rocking the law. Let's get started with the show.
Hey everybody, good afternoon. I'm Patty Finn, the Good Health Lawyer, and you're listening to WRCR Radio, 1700 AM. You're streaming live at 5 on Facebook and YouTube and all those other nasty social media places. But we welcome you to tune in and turn on and all things good with good health. We have a really great show today. I'm so excited that we have our guest, Bernadette. Allow me to introduce my co-host, every pager. Bernadette, our guest, probably one of the, they're all special, but he gets the star this week for his big win. He's going to talk a little bit about that, but I did explain to you about the temporary restraining order, didn't I? Did I tell you about that?
Everything went dead for me for a little bit, but now I'm back. I can hear you. So hello, Patty. I'm not sure what I missed, but you go ahead and tell me about something.
Well, I was introducing you, our guest, but I'll tell you what, I'm going to go right to our guest because if anybody's going to explain what happened, he can. So, ladies and gentlemen, allow me to introduce Chris is the attorney that won the landmark temporary call it landmark because Kathy Hochul will be, but he had a big win in New York. We have a judge upstate New York that has restrained the state from denying religious exemption. Chris, everybody I spoke to wanted to issue boundless thanks, and we want to hear about what's going on with the case.
Well, as you know, and as the press has reported, we obtained a temporary restraining order against enforcement of the rather ridiculous vaccine mandate, which pretends that it can sweep away the protections of Title VII and the New York State and New York City human rights laws respecting the accommodation of sincere religious beliefs. And the mandate was making it impossible for nurses, doctors, and other medical professionals and the covered entities to obtain religious exemptions to vaccination with the available COVID vaccines, all three of which are connected in one way or another to abortion via fetal cell lines. Now, these people are entitled to an accommodation of their objections to these vaccines, and the accommodation would be nothing more than what they've been doing for the past 18 months when they were hailed as the heroes of the front line in the battle against COVID. They wear masks, perhaps sometimes a face shield, maybe even goggles on certain occasions. Those were certainly sufficient for the hospitals and hospices and other institutions where these frontline heroes work. But now all of a sudden they're pariahs because they won't be injected with these abortion-connected vaccines. Well, Judge Hurd has issued a temporary restraining order preventing the application of this mandate and allowing these medical professionals, 17 plaintiffs, doctors, nurses, a medical technician, and a physician's liaison, to apply for and obtain religious exemptions from COVID vaccination. And since the TRO was entered, numerous plaintiffs have obtained these exemptions or had previously revoked exemptions restored, and others are having their exemptions considered. It's been an interesting development just today in the case
Oh yes, I saw that, but I didn't even have a chance to read. What happened?
Well, the state was seeking to accelerate the proceedings by having the oral argument on whether the TRO should be made into a preliminary injunction. Have the argument on the 24th of September instead of the 28th of September, which we viewed as obviously unfair to us. It would leave us almost no time to answer the state's responding papers, which were due on the 22nd. We would have had to travel to Utica for the argument on the 23rd, so we literally have only a few hours to review their response. And this, in our view, was clearly an intent to blunt the TRO before it takes effect, practically speaking, on the 27th of September. Well, the judge wasn't too happy about that, apparently, because he issued a new order today canceling the oral argument that was on for the 28th, advising the state to file its brief on the 22nd anyway, extending the TRO to October 12th of 2021, and advising the parties that no further appearances would be required or permitted, and that the court would issue a decision on whether the TRO should be converted into a preliminary injunction. That decision would be issued on or before October 12th in view of the likelihood of irreparable harm, as the text order states. So obviously we view this as a positive development. I think the state outsmarted itself trying to get the case accelerated instead of heard according to the schedule the judge had originally established.
Oh, that's actually, matter of fact, right before we went live, it came up in my news. And I don't know if people realize how significant this is. And Bernadette, a lot of lawyer jazz going on here. But the bottom line, we had an attorney representing the Thomas More Society and on behalf of Christians that objected to fetal cell components, either within the vaccine or used in the manufacture and testing of the vaccines. They objected on religious grounds. And a few months ago, everybody here in New York, probably everywhere, knows that the new governor yanked the right for religious exemptions for healthcare work. So this is simply extraordinary. And I think this is great. Now, I did want to ask.
Let me jump in and say
Yes,
something.
please.
There are no actual fetal cells in the vaccines. The way it works is fetal cells could be used to test the proof of concept, see if fetal cells could be prompted to follow the mRNA instructions to generate the spike proteins, or they could be used in development in other ways. Only the Johnson & Johnson vaccine actually uses fetal cells to produce the vaccine product, but then that is supposedly purified before it gets into the vaccine so that there's no remnant of fetal DNA in the actual vaccine. But the vaccine is essentially generated inside of fetal cells in the case of the Johnson & Johnson vaccine. In any case, these clients object, rightly so, to any connection to abortion. Some say, well, it's just a remote connection. You don't have to worry about it.
Yeah, like the Pope. The Pope.
Yeah, and the Pope says that, this is an issue too, that these people are being confronted with the Pope's beliefs in the matter. And religious discrimination law is clear on this point. It doesn't matter what the Pope thinks. It's funny how Catholics can disagree with the Pope on all manner of things. And Nancy Pelosi can disagree with the Pope on abortion, for example, the murder of innocent human beings. And she's perfectly entitled to call herself a Catholic. But somehow when it comes to the vaccine, the fake news media wants all Catholics to agree with the Pope. I find that curious. But religious discrimination law is clear. Your subjective, personal, sincerely held religious belief is all that matters. It doesn't matter what the Pope thinks or what any bishop thinks. The test is what you think and what you believe is a sincere religious conviction. And that's what's being defended here.
Yeah, could I ask a question here about your particular case? Is everyone involved? Is that their particular religious objection, or is it more broad than that? Because it's my understanding, like if you believe that self-harm or caving to coercion are sinful, that's not your lifestyle choice. That's not your religious choice, right?
That's absolutely right. There is also that element in the case. We do plead as a sincere religious conviction. their belief that everyone is entitled to make a risk-benefit assessment as a matter of religious conscience and ask himself or herself, do I want this substance injected into my body? And if you make a risk-benefit assessment and you say to yourself, no, I don't, as a matter of religious conviction, these plaintiffs say the state has no right to enforce a vaccine in terms of a mandate and compel people under threat of loss of livelihood to be vaccinated against their will. So that is a broader element of their religious claim.
That's excellent. Yeah, I'm really glad to hear that.
Yeah, I'm
And
really
in fact,
glad
the complaint specifically recites that they all agree that the body created in the image and likeness of God is a temple of the Holy Ghost, and no one must be compelled to violate that precinct, that sacred precinct of the human body, by forcible injection with a vaccine that is against their religion and which doesn't have utility for them according to their own risk-benefit assessment. Who was the governor of New York to tell anyone that the risks of this vaccine are not outweighed by its benefits? That's for each individual to determine, especially these plaintiffs who are trained medical professionals. They know much more than the current governor of New York about these issues.
Yes, the poli-sci made.
Yeah, she's a poli-sci major.
Yeah,
I majored in poli-sci, but okay.
Ridiculous. Well, that's the whole problem with the COVID regimes, that politicians are meddling in medical affairs and they're promoting ridiculous superstitions, as far as I'm concerned, such as this absolutely nonsensical ritual mask wearing, which is now so inconsistently applied that it's a complete joke.
Right.
And you see gala events where the celebrities aren't wearing masks, but the waiters have to wear masks. Are you kidding me?
And they're not wearing
so
clothes.
obviously at this point, it's just a ritual. It's a ritual. It's kabuki theater. It's
You know what though? You just opened my eyes to something. I realize now why the mayor in his passport, that the mayor's passport that's in place here now, it did provide exemptions for athletes and performers. Now that I'm thinking about it, that's why he did it, because the performers coming into New York, like at the Met Gala, I don't know if either of you had seen that last week, but I think 3 of the girls, women, had absolute see-through dresses on. I think it was Kylie Jenner, one of the Jenners, and a couple of the girls. But not only did they not have masks on, they
were hugging and kissing each other.
Yeah.
I mean, the wait staff, you know, the plebes, the unwashed, the inferiors, they all have to wear masks.
Yeah.
I mean, listen, let's be clear here. If you want to wear a mask because it makes you feel safer, go right ahead. But if you look at the mask mandates, I'm fighting one now in New Jersey. They're so full of exceptions as to be ludicrous. The one that we're fighting now is in public schools. So in public schools, and private schools, parochial schools, any kind of school, according to Governor Murphy, these poor kids have to wear masks 8 to 12 hours a day, or 8 to 10 hours a day, however long they're in school. But they don't have to wear masks when they're outside when they're with adults in other indoor environments. And even in the school, there's all kinds of exemptions. You don't have to wear it when you're eating in school. If it gets too hot in the classroom, you don't have to wear it. You don't have to wear it in gym. You don't have to wear it if you're engaged in strenuous exercise. By the time you add up all the exceptions, these poor kids are taking that mask on and off all day long. And every guideline on mask use says you're not supposed to do that because the mask becomes contaminated. You think these kids are going to follow these elaborate safety guidelines? Read the CDC guidelines. Read health department guidelines on how you're not supposed to touch a mask when you remove it because it's contaminated. And these kids are expected to wear them all day long. Take the contaminated mask after lunch and slap it back on your face, little kids, and wear the contaminated thing all day long. It's absolute nonsense.
Bernadette,
tell science. It's like a medieval superstition masquerading as science.
Bernadette, tell them about that test that you published about 6 people that tested their masks and what came back.
Oh yeah, that wasn't us. That we shared that story. It was some moms down in Florida who did an experiment with these little kids, like 6-year-olds, and then one of the teachers, and they put on brand clean masks and they wore them for 6 hours, gathered them up and sent them to a university lab to be inspected. And there were so many disease-causing pathogens, bacteria, because what is a mask in front of your mouth but a warm, wet Petri dish?
Okay,
And
let me stop you right there. Now they're going to say, well, this is conspiracy theory. You people are kooks. Here's the guidance of the San Francisco Health Department about how to use a mask. San Francisco Health Department. This is real science, which they're ignoring with these poor school kids. Disposable face masks should be used once and then thrown in the trash. Are the little kids in school going to do that? No. It goes on to say, clean your hands with soap and water before touching the mask because it's contaminated. Avoid touching the front of the mask. The front of the mask is contaminated. This is the San Francisco Department of Health telling you how to handle the mask.
Yeah,
contaminated, use them once and throw them in the garbage. That is not what's happening in public schools.
And the states are not keeping track of it either. You don't know what the health effects are of the masks. The kids are, nobody is tracking whether or not they're safe and effective. And as everybody knows, I'm on a mask case here in New York. And actually, Chris, I wanted to tell you about a case that was decided last week. And I think, at least as far as the mask go, this may be the solution, because the way we go about it is, we try to knock them out on authority, not necessarily the science. Does Governor Hochul have the authority to mandate masks? Does the Mayor de Blasio have authority to put a passport in place? I was in New York City on Saturday at the World Freedom Rally, and it was an anti-vax rally. And I couldn't find a ladies' room anywhere for a humanitarian break because I was banished from, every building in the city, and it makes absolutely no sense. But I did put the mask on. I tried to sneak it. I tried to appear vaccinated, but it didn't work. But I want to tell you
about— You're not allowed to access a building with a mask unless you were also vaccinated.
Right.
That's unbelievable.
Yeah, it's unbelievable.
That's the next legal challenge. But getting back to this case.
Yeah, let me tell you about this case. Tom DeVore, he's a lawyer in Illinois, and he brought a case challenging the authority of the quarantine orders. And I'm going to send this to you, Chris, because we intend to this in our case. But basically, it said that a mask is a quarantine. Okay, that's what's significant. The judge described masks as quarantine. And if they are quarantined, there has to be an order from the health department subject to judicial review. And here in New York, anybody that wants to look it up, it's 10 NYCRR.60. And under that regulation, it's very clear that nobody can quarantine anybody other than the commissioner of health. And that is in a declared emergency, which we do have. But with regard
Not
to—
anymore, you don't, because the governor ended the state of
That's
emergency.
right. Yes, I'm
June.
sorry. Thank you.
In this case that I'm involved in with the TRO against the vaccine mandate, masking is not an issue because in the health context, which is where all these plaintiffs work, obviously it's standard procedure to wear an N95 mask or some other device such as a face shield. We're not having a problem with that in a medical context. These masks are meant to be used for source control in a hospital environment. And if you've ever worn an N95 mask, as these workers, these healthcare professionals do, you know how difficult it is to breathe through those masks. That's why they're used for short periods of time in a hospital setting or in a hospice setting. Never have we seen a mandate that everyone in the world literally walk around with a face covering. But in this case that I'm involved in with the temporary restraining order, that's not really an issue because these medical professionals are perfectly willing to follow hospital regulations on mask wearing because those masks, the N95s, are rather effective in blocking transmission and also a source control. So that's not an issue in my case, but the mask mandate for the general population is going to be an issue in other cases, including the one I'm litigating
in New Jersey and ours in New York that we're filing opposition on Thursday. And I'm going to move to end the complaint because the governor actually did away with the regulation that we were challenging and passed another mask mandate, different provision of the law. And then the state moved to dismiss, arguing our point is moot. But it's not moot.
Yeah, for whack-a-mole. They play a game of whack-a-mole.
Yeah.
Cheat one regulation, and then they pop up, another one pops up somewhere else.
Oh, wow. We were calling it the old switcheroo. So what did you call whack-a-mole?
Whack-a-mole. Yeah, you hit one and another head pops up. But your case is not moot. Obviously.
No, not at all. I mean, every kid in the States wearing a mask to go to school. So I think it's outrageous that the state did this, and they were watching everything we were doing. The day that our decision, or our case was to be heard, the governor did a press release, the emergency's over. They're going to have fireworks and it's all over. And I was like, what's over? Everybody's still being forced to vaccinate, still have to wear a mask mandate. And it seems to me outrageous that our government officials are spending all this money trashing us as conspiratory maniacs and all this other stuff, instead of focusing on the law, instead of focusing on what is right and what they need to do. They're trying to figure out how to get around the lawsuits. That is all they're doing. And I know there was something published in New York on social media that mask mandates had been withdrawn, and I'm not really sure where that came from, but I can assure you they have not been withdrawn. In fact, they're crazy as compared to a state like, say, Florida, or South Dakota, Texas. They're extremely reasonable. But Chris, if I were you, I would definitely check out that Chicago or that Illinois case and take a look at that judge's order. And I'll send it to you after the show. But it does appear that a mask, at least this one court has determined a mask is a form of quarantine, and as such requires an order from the health department. So it can't executive order. So isn't that your situation in New Jersey? You have an executive.
No, we have nothing but an executive order.
An executive order.
And it's curious because Murphy ended the public health emergency under the Health Powers Act back in June, and has continued the Disaster Control Act emergency. So he has two different emergencies. He got rid of one, but he has another one going. So that's some kind of free-floating generic emergency that he keeps in his back pocket so he can keep issuing dictates.
Right.
But how do you have a Disaster Control Act emergency if there's no underlying public health emergency?
I don't know. I mean, I can't even keep up anymore. They're so clever. They're so sneaky, trying to get around and wiggle into this and overcome that, but I know the government in New York has been watching, our every move, and every time we move, they do something to stop us, and it's really been very, very frightening. So
it's a litigation tactic. So if they voluntarily cease unlawful conduct in response to litigation, only to resume it in another guise, that's not moot at all. It's just an attempt to evade judicial review, and judges will, or at least they should, recognize that this is a litigation tactic. It happens again and again in these COVID cases. You challenge one regulation, they pass a slightly modified version of it and say, we just mooted your case. No, you haven't.
Yeah.
The claim is basically the same. It's just that you change the number of your executive order. Maybe you fiddle with a couple of terms of it. And I'm getting my phone calls here. Which reminds me, I have to really run like.
Yeah, I just want to tell you one thing, and then I'm going to let you go. I've received numerous emails, people sending you love and prayers and thanks, and they're with you 100%. And I have some questions about how this does affect religious exemptions, but I'll take care of that after the break. Anyway, I don't know what to say. I was flattered that you came on the show.
Oh, no, not at all. Your show's really important, and I'm glad you invited me on. And I'll be happy to come on again when I get through some of this stuff I'm doing right now.
Oh, well, what date is it? August 12th? We'll be sure to have you on after you.
October 12th.
October 12th. October 12th.
Well, let's not make any predictions, Don't do that.
Yeah, I know. Actually, I always believe I'm going to win. Never go in the case with the mindset we're going to, because I don't think that's good. And we will win ultimately. And if it's not this round, we'll win the fight if round. Anyway,
you got to be a good advocate. You have to believe that you're going to win. You have to believe in your cause,
and you have to believe in our faith. And I see your icons behind you, and you're a faithful man. And I'm telling you, the prayers are pouring in here. You're an absolute hero. And thank you for everything.
Thank Michael McHale, too, my co-counsel.
Oh, okay. All right. I'll
join at the hip. We're a team.
Yes. All right.
I got to run, but I'll come on again soon.
All right. Thank you. Thanks so much.
Take care.
Yeah, thank you.
Bye-bye. Let's, we're going to take a short break here for a commercial, and we'll be right back with the Good Health Lawyer Radio Hour. This is WRCR 1700 AM. We'll be right back.
Tune in to the Good Health Lawyer Radio Hour, live at 5 Drive, every Monday on AM, rocking your health and rocking the law. Let's get started with the show.
Hey, all right, we're back. Bernadette, wasn't he?
He was remarkable and kind of precious, and there's another attorney here in Washington State that, is similar to that. You just want to hug them. Brilliant people following their passion, standing up, doing the right thing. I love it.
And he won.
And he won. Yeah.
That's there haven't been a lot of wins. I mean, they'd have that big win in 1999 in April with proving there was no measles epidemic. Mm-hmm. And then we won the medical exemption case, which now on appeal. But other than that, it was pretty quiet. I mean, there were cases brought, but unfortunately, they didn't go too far. I'm getting a lot of questions about, what does that mean? What is a TRO? And, what does it mean? And there's a couple of things that I want to address.
Okay.
Some people have asked me, does that mean the hospital has, or the school, or well, it's hospitals right now, they have to accept a religious exemption? And the answer is no, that you still must demonstrate sincerity in a written statement, which in and of itself is unconstitutional. And religion testing is a problem, but it has been going on a long time. New York is notorious. And we've helped probably 25,000 families over the last 20 years articulate their religious beliefs, their sincerely held religious beliefs, in order to get the exemptions. And, done quite a few medical But I just want everybody to be that, no, you definitely, it doesn't mean you can walk in the door and just say, I'm a religious person. Over. There's still quite a battle to go. The other question people have is they want to know about the requirement in New York or at many institutions that you get a letter from your clergy, your rabbi, somebody to support your religious beliefs. And as you know, we talked about the Pope earlier. If you are Catholic and you're asserting a Christian based religious belief, you are definitely not getting support from your church. So, what do? Well, the law is very clear. The Supreme Court has advised that you do not have to be a member of a particular religion in order to have religious beliefs contrary to vaccinating. So that's another big thing. So if you are asked for a letter from clergy, rabbi, you really don't need to get it. And often I would say 90% of the people that we deal with cannot get it. So the idea here is it's a personal religious belief. It's how you interpret the statute. What I mean by that is that you and I could go to the same church, could sit in the same pew, and we could same scripture, and I could walk out leaving that, everybody should get a vaccine, required to get a vaccine. And you could, interpreting the same scripture, go back and determine that vaccines violate your religious beliefs. So the court's been very, very clear about that. I just wanted to add that. Do you have any questions about what Chris said?
No, I did follow it all. I wanted to read to you something that we've had on our website for a couple of years now, and it's Executive Order number 13798 in federal regulations, and it's from the United States Attorney General. This is from 2017 about the freedom of religion being a fundamental right of paramount importance, expressly protected by federal law. And this is what he says: the religious liberty is enshrined in the text of our Constitution and in numerous federal statutes. It encompasses the right of all Americans to exercise their religion freely without being coerced to join an established church or to satisfy a religious test as a qualification. This for public office. So this is specifically public office, but it applies to the general public and holding any job. It also encompasses the right of all Americans to express their religious beliefs, subject to the same narrow limits that apply to all forms of speech. In the United States, the free exercise of religion is not a mere policy preference to be traded against other policy preferences. It is a fundamental right. I just love that quote. And it's so being abused here in Washington. So we've got two things going on in Washington. One, our governor was caught. Somebody did like a public records request, got a hold of an email where him and his attorneys were working on religious exemptions for their state mandate that they put out for certain workers, making it so narrow nobody would qualify. And they are now attempting to coerce some state workers, saying that we cannot accept your religious exemption because you've been vaccinated as an adult before, which is absurd. You can religiously approve of one product, but not another, right? But they're even saying if you had any medical intervention at all as an adult, you don't qualify for religious exemption. That's a certain segment of state employees that are this preposterous religious test they're being put to. But the other thing, Patty, I really wanted your opinion on, I'm hearing from people in the healthcare field that their employer did accept the religious exemption, but then they said, but because you work with patients, we can't accommodate you, so you're fired. So they're accepting the exemption and then firing them.
Yeah, we've come across that for New York, and we're working on that. That's a new wrinkle. Nobody had really approached those employment law issues prior to this because it wasn't an issue. We were entitled to the religious exemption, and then it was granted, and got to wear a mask or something like that. But now they're not accommodating you, and that's a whole nother can of worms. And
so
big,
for a year and a half, a mask and maybe regular testing, which I don't agree with either, but those were okay, but now they're not. Right? Yeah, it's just being held to an impossible standard.
We have that problem in New York, with the children. In 2019, they did away with our religious exemption, allegedly responding to the worst measles outbreak. Meanwhile, a month before that, a judge in Rockland, where we are now, we're here in outside of New York City, the alleged epicenter of the measles outbreak, reviewed the government's evidence and determined that I think it was 169 cases of measles does not rise to the level of a deadly epidemic as defined in the case in case law in the statute. And he struck down an injunction. And then a month later, the legislature had a debate, or call it that, or actually, I attended. What are these people doing? I mean, the stories, everybody, the senators and the assembly people, they all got up and told about their story of me. They were little. One senator, listen to this, one senator claimed she had the measles. She got the vaccine. She had the measles again, and she gave it to everybody in her family. And I was like, no, I don't really believe that.
Well, and not especially since she actually had the measles, because, lifetime immunity is well established with actual measles. So, but you know what we're finding? There is some science suggesting now that if you have wild immunity and then you get vaccinated, it undermines your natural immunity. So that may possibly, there's so much science that has not been done. But Patty, what I want to see is it got in court where you could say, okay, you prove that a vaccinated person is significantly less capable of spreading infection than somebody with, let's do two, wild immunity to COVID-19, or a naive person never have been exposed to the virus, so they have no immunity at all. Let's look at all three of those and let's see the science, who is, and see if there's just a tiny margin of difference between the non-immune, non-vaccinated and the vaccinated, because we know that the vaccinated fully colonize and they transmit. So, you're going to kick somebody out of a job for a matter of degrees.
Greg Glazer of Physicians for Informed Consent, he's actually working on it.
Fantastic.
He has a petition in the Supreme Court. I think he's seeking a temporary restraining order, but the idea is that there should be exemptions for natural immunity. What I believe is going to ultimately happen is the Supreme Court will continue to uphold mandates. There's no question. But I think what they will do is loosen the chokehold on the exemption and allow for religious, medical, and natural immunity. Quite frankly, is 90%. I think right now, COVID has spread. We're not giving medical advice. You really should go to the CDC to, get your medical information. But there is evidence, yes, that, COVID has circulated throughout the population, particularly among children. You want children to get COVID. Want them to get it because they're asymptomatic, the majority of them. They recover and then they strengthen herd immunity. Herd immunity does not exist. It only exists in nature. It has never been proven vaccine induced.
No, you can't, because that's always partial immunity. You can't, and especially with these COVID shots, because all they do is make your body make antibodies to a genetically altered, stabilized spike protein. It's not even the same spike protein that's in the wild virus. It's a completely different animal, right? And so you're making antibodies to that, and oops, they have seen that antibodies to that do not prevent you from actually becoming infected. And then because it allows you to become infected, even though it might lessen your symptoms in some cases, although not always, they're showing now that you're at higher risk for severe disease to the Delta variant. There's antibody enhancement going on there. Oh shoot, I forgot I had a main point that I was going toward, but anyway, it's a completely different animal, and we don't know what then the long-term effects are, but it's completely different. Oh, because the virus is allowed to go in you and breed, and you're not shutting it down. This is leading, according to the virologist, to some of these really extreme variants, because you became this nice host to freely breed in because you're not shutting it down, right?
No, though that's been going on for a long. A lot of people are talking about COVID and saying, "Oh, it was out of a lab in China." This whole thing was, they knew about it. Looking today at labels for COVID-19 vaccine drugs that were dated from 2017.
I saw that. I saw it 2016 that there was part of it, the packaging of the vial or something at least was made in 2016. But when it comes right down to it, if we had common sense, if you put all politics and greed aside and you just look at common sense says that humans have beautiful immune systems. If properly supported, we get through disease very well. You've got a 99.9% chance of recovery. You bring on these nutrients, you do well. And if you have your go-to kits ready to go, in fact, this might be a good time. Do you want me to share?
I do, but I did want to just wrap up that point on natural immunity.
Mm-hmm.
You definitely want it to spread naturally. And we have been manipulating diseases in the United States vaccine program for a long, long time. And it's pure Frankenstein. No one knows what's going to happen. And I remember when my son was little and his pediatrician was telling me about DTaP or pertussis, and that it had mutated from from
Mm-hmm.
and this was, I was a young parent then. I was doing my own thing like now, but I didn't know anything about vaccines or my religious. I was just crazy. You're going to inject me with where's the needle come from? And they wonder too why children, all these young kids are getting hooked on heroin and injecting and everything. Well, we've injected them they were born. There's absolutely no fear of needles, nothing. Everything is a drug, a pill, a needle, and I think psychologically that is contributing to the widespread use of drugs, of particularly the injectable drugs.
Yeah, well, we have been artificially interrupting, disrupting, and skewing infant immune systems for decades. And we know now so much more than when we began this. We know that your immune system is directly tied to your neurological system, to brain function, to mood, to the ability to even function in society. We have so screwed things up for our kids because nobody will look at the long-term effects. I mean, nobody meaning our public health agencies refuse to look at the unintended long-term consequences of interrupting the immune system from day one of birth, from prenatal, with
Right.
vaccinating women, all the way up. And, we've thrown the baby out with the bathwater. Sure, we don't want people to die of infectious disease. Right, but there's another way to do it. And I think that all this COVID, we need to flip the paradigm. It needs to be nature first, drugs last. We need to make a healthier society so that our immune system can be exposed and become robust natural herd immunity. If we live in a bubble, we die. So why do they want to create these artificially injected bubbles that can't do the job anyway and skew our immune systems? The whole thing is just, it's very profitable for the drug industry, but it's not healthy for individual health. That's where we are now.
So on that note, on that segue, let's go to this COVID-19 kit. And,
yes.
What you, if been exposed,
Mm-hmm.
A very helpful video we showed last week. So here we
yes.
go.
Are you seeing it, Patty?
I am.
Good.
These are the founding physicians of the Frontline COVID-19 Critical Care Alliance. They convened to develop highly effective treatment protocols to prevent the transmission of COVID-19 and to improve the outcomes for patients ill with the disease. Today, they want you to know how to prevent COVID-19, even against the variants. This is the molecule of ivermectin, the medicine that can end the pandemic. Ivermectin was discovered and developed in 1975 in Japan by Dr. Satoshi Omura and Dr. William Campbell. In 2015, Drs. Omura and Campbell each received the Nobel Prize in Medicine for ivermectin's discovery. They deserved it. The medicine has brought relief and saved the lives of millions across the globe for nearly 40 years. Ivermectin was first used in humans in 1987 for the treatment of parasitic diseases. It has eradicated pandemics of numerous diseases for 4 decades. Plus, for nearly 40 years, it has been given safely across the world nearly 4 billion times. Ivermectin is on the World Health Organization's list of essential medicines. It has been deemed to be one of the safest medicines known to mankind. But this workhorse of a drug is not yet finished. In the past 8 months, numerous controlled clinical trials are reporting consistent, large improvements in COVID-19 patient outcomes when treated with ivermectin. People treated with ivermectin experience numerous clinical benefits: fewer infections, reduced inflammatory markers, more rapid improvement, more rapid viral clearance, shorter hospitalization, and a reduction in mortality. As you can see, ivermectin has been very well studied across the world. In fact, the amount of scientific medical evidence is mountainous. As of July 16, 2021, 60 clinical studies, including 30 randomized controlled trials, have evaluated the role of ivermectin in the treatment or prevention of COVID-19. Here's how it works. Ivermectin inhibits the replication of many viruses, including SARS-CoV-2, influenza, and others. Ivermectin has potent anti-inflammatory properties with multiple mechanisms of action. Ivermectin diminishes viral load and protects against organ damage in animal models of SARS-CoV-2 infection. It prevents transmission of COVID-19 when taken either pre- or post-exposure. It hastens recovery and decreases hospitalization and mortality in patients with COVID-19. And it leads to far lower case fatality rates in regions with widespread use. Then, when ivermectin is used with the additional components in the FLCCC Alliance's iMask Plus protocol, it can work even better in preventing COVID-19. So here is what the FLCCC Critical Care Physician Team recommends. Just like you keep a first aid kit around the house, please start keeping a just-in-case COVID kit. Here is what the kit contains: ivermectin, vitamin D3, vitamin C, quercetin, zinc, melatonin, and gargle or mouthwash. You can find our Eye Mask Plus protocol, plus all of our prevention and treatment protocols at flccc.net. We wish you a lifetime of good health.
That is actually have a coach. I don't have it all in one spot, but I think I'll do that later tonight when I get home. That's a great video. Thank you. We got a lot of positive back on that last week, so I thought it would be a good idea to share.
Yeah, we all need to just be prepared. And the other thing I highly recommend is everybody right now go in search of a medical practitioner, MD, ND, OD, whoever, somebody you know and trust who's aligned with your way of health and healing, to be your professional, to guide you through COVID or anything else to come. And do that while you're not sick. Because I tell you, when you catch something that's been in the news and they're trying to terrify you, you just feel so much more confident having that professional to be able to call up or see to help guide you, so you don't panic. And I've got friends here. Those who had the COVID kit on hand have handled the illness very well. I've got another I'm just praying for who was too late to start, didn't have the COVID, and is in the hospital on a vent. And I'm just praying that, the hospital will not hear of doing any of the good protocols. You have to sue hospitals to get them. I don't understand that. I don't understand why you have to sue to give a drug that's on the World Health Organization's most essential medicine that won a Nobel Prize that all the experts say is safer than aspirin. If you've already got somebody that's critically ill and they have nothing better to offer, why do you have to sue them to give this? Something very, very wrong with this.
We had a judge upstate New York ordered at last check. 2 hospitals were ordered to give ivermectin very sick patients, and they were elderly, and they both recovered. And
good.
So we're really happy about that. Well, anyway, Bernadette, we're at the top of the hour, and we'll be signing off till next. And I just want to thank you as always. You're wonderful, and you're so enlightened and calm about this subject. I think a lot of our listeners always benefit. And tell them about your show on Fridays.
Yeah, every Friday from 3 to 5 p.m. Pacific time, and Informed Life Radio, 2 hours. We bring you scientists, doctors, attorneys, just like you do, Patty, to have these sort of honest, real, uncensored conversations. AM radio, let's pray that it continues to be a place for free speech, uncensored speech. So I'm really grateful to KKNW that allows us to have our show there. And I'm grateful to WRCR that brings your show to the airwaves. That's fantastic.
Thank you. Yeah, we love it here. And I want to thank all our listeners and anybody that has any questions. You can certainly follow me on social media or go to my webpage, patriciafinnattorney.com. We're always looking for donations to help our pro bono work, and you can find the information on our website. All right, well, thank you all, and I'm Patty Finn. I'm the Good Health Lawyer, and you are listening to WRCR Radio, 1700 AM, and we'll be back at you next Monday for the Live at 5 show. It's out. Bye.